Hello, my name is Walt Beaver. I'm one of the hip and knee surgeons here at OrthoCarolina, and I'm going to talk to you today about perioperative, the perioperative time between your surgery before and after the surgery. We call the time right before your surgery and right after surgery the perioperative time. Normally, after you see your surgeon and surgery scheduled, you have anywhere from 4 to 8 weeks before your surgery. During that time, there's several things that will happen. The first thing is normally you'll get blood work beforehand to make sure your blood is okay and all the tests are normal, so it lowers the risk of your surgery. Also, you'll be scheduled to see one of the medical physicians at the hospital to have a physical exam, again, to make sure you're healthy for surgery. Now, after the physical exam, those same internists will follow you while you're in the hospital to make sure that you remain healthy as far as heart, lungs, kidneys, and other things that are out of our expertise. Now, you sometimes will have physical therapy beforehand, so you can strengthen your leg before the surgery, whether it be a hip or a knee replacement. Normally, the hospitalization is anywhere from 1 to 3 days, and when discharged from the hospital, several things will occur. The first thing is that you start physical therapy. Although you've had physical therapy in the hospital, for the first 4 to 6 weeks, you'll have physical therapy after your surgery. The surgery is a little more intense with knee replacements versus a hip replacement, and normally it's about 3 days a week. You work with a physical therapist, and that goes for about 6 weeks. Now, in between times, when you're working with the therapist, you'll be doing quite a bit on your own. A lot of it has to do with strengthening the leg and also regaining your motion of your hip and of your knee. And the therapist will give you exercises to do during that time. Now, there are 2 ways we prevent blood clots after surgery. One is with aspirin and one is with Coumadin. For those people that are on Coumadin, if they have a higher risk for blood clots, then they will have their blood drawn twice a week to make sure their Coumadin level is at the correct level. If you're on aspirin, you'll have no blood drawn and you don't have to worry about anything after the surgery as far as getting blood drawn. You will also have a return visit to see us to make sure that everything is okay. That return visit is usually within the first 2 to 4 weeks of your surgery to make sure the wound is doing well and your range of motion is progressing as it should be. And obviously, if there are any problems and you think things are not going like they should, you'll call the office because we're always available 24 hours a day. Thank you very much.